from News Channel 8, this is Good Morning Washington.
So ahead here, a medical marijuana that's safe for children. A doctor discusses the impact of medical cannabis before Maryland opens its doors to dispensaries. First, though, here's your play of the day. Well, like it or not, medical marijuana dispensaries in Maryland are close to opening their doors, and parents will be considering cannabis-based treatments for a wide range of pediatric and adolescent conditions. So here to weigh in on medicinal cannabis use for children is Dr. Shivani Amin. Thank you so much for being here today.
Thank you for having me.
There's a lot to unpack here, and I want to ask you first. I think parents hear medical marijuana and a child and think, my kid's going to get high. Is that the case at all?
No, and I think it's important for parents to, as well as the society in general, to know what is cannabis, right? What is marijuana? It's actually a plant that's composed of over 80 different chemical compounds. And when we think about marijuana, the first thing that comes to mind is THC, that chemical compound that produces that psychoactive high. However, there's another chemical compound that THC tends to overshadow, which is called CBD. It stands for cannabinoid, and that's the portion of the plant that doesn't produce any psychoactive, like that euphoric high that you get from THC. It's actually proven to be extremely beneficial in its anti-inflammatory effects, as well as being neuroprotective. And recent studies have shown that it's killed off, actually causes cancer cells to kill themselves and stop spreading.
Okay. When we talk about medicinal marijuana for children, what illnesses or diseases or medical issues are we addressing here?
So medical marijuana can actually cure, or not cure, but help a host of different conditions. But when it comes to children, we're basically referring to epilepsy, autism, and cancer. So children that have more terminal illnesses.
How effective has it been in children that you've seen?
Very, very effective. I mean, even there's a doctor out in LA that all she does is, work with CBD with children. There was a case where she had treated a 14-year-old teenager that was told she was going to have 9 months to live. Turns out she added the CBD oil to her chemotherapy, and she's now 9 months cancer-free.
Wow. Okay, now you mentioned the oil. What other ways is this dispensed?
In the state of Maryland, it's going to be dispensed in capsule oil, the actual flour that you can get and put in food, patches and lotions.
Okay. And if you are a parent who has a child with a medical issue, how do you go about pursuing this as a possible form of treatment? Because can you just go to your regular pediatrician and say, hey, can I get a prescription? How does that work?
So you have to be seen by a certified physician. Okay. And the parent has to be registered first as the caregiver. And then the child registers themselves, and the parent can end up buying the product for the child.
Okay, so this is something you have to all get certified to do.
Correct.
So if you're worried that your kid is just going to go to a dispensary and get what not happening. And the kid can't do that under 18 anyway.
No.
Okay. Is this safe?
Yes, I mean, when I talk about medical marijuana in children, I'm not speaking of that THC portion that causes a psychoactive high. I'm talking about the CBD that has been proven, multiple studies have shown that it has tremendous medicinal benefits, such as being anti-inflammatory, neuroprotective, and helping with the cancer cells to help them stop spreading.
Are there any long-term effects? Because we're talking, I mean, a kid maybe as young as 4 years old or 5 years old could be using maybe the oil or something like that. But is there a long-term effect on their developing brains, their bodies?
Actually, because CBD's been proven to be neuroprotective and anti-inflammatory, there have been recent studies that have shown that the anti-inflammatory and the neuroprotective, they believe that it causes the brain cells to actually, instead of replacing themselves. Okay. So unfortunately, we don't have enough evidence because marijuana still remains a Schedule I substance under federal law. So
you can't research something that's not in use.
No, and most of the studies are coming from outside countries, such as Israel and Europe. So hopefully within the coming years, as more and more states become legal, we'll have more data and we'll be able to do more clinical research on that. But there's no evidence that shows that it has any life-threatening side effects.
I know parents are going to have a lot of questions. Where can people find you?
So I've created a company with another physician called Green Health Docs. They can go online, type in Green Health Docs with an S at the end.com, or they can call or text us at 240-356-1000.
Awesome. Thank you so much, Dr. Amin. Appreciate you being here for all the information.
Thank you for having me.